Up Healthcare Solutions webinar. We're excited to present Automate Patient Credit Balances in NextGen. My name is Chelsea Grover and I'm the Marketing Communications Manager for Attentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. Next, I have some super exciting news to share with you all. Attentive is now part of DAS Health. DAS Health is a leading provider of health IT and management solutions and a trusted consultant to many physicians groups, hospitals, and healthcare systems across North America. By combining our skills and expertise, we'll be able to provide even more support, value, and solutions for your practice. We're looking forward to continuing to serve you. And I want to reassure you all that we're still here for you. We're still going to be here specializing in NextGen and keeping our focus on you. This partnership just enables us to do that even better than we were doing it before. As an FYI, everyone's phone will remain muted the entire time. Please use the webinar control panel to ask any and all questions. We'll answer them all at the end, but you can ask them anytime. Okay, so let's get started with some super quick polls. Let me launch the first one here. And this just helps us to know what to focus on since we have a number of different practices in today as far as what issues you're trying to solve and why you're here. So if everybody will take a few seconds and look up at their computer screen, super easy poll. What patient credit functions are you looking to optimize? Issuing refunds to patients, issuing refunds to insurances, moving line item credits between charges and encounters, or managing balance control issues on the same charge. And I believe you can actually select all that apply. So we're looking forward to seeing what you're struggling with right now, what we can help with. And I'm going to close this in 5, 4, 3, 2, and 1. So let's close this poll. And just so you feel better about where you stand today, it looks like a lot of you are in a very similar boat right now. It looks like everybody's having problems with issuing refunds to patients, moving line item credits between charges, and managing balance control issues. And a lot of you are also having trouble with issuing refunds to insurances. So we got a lot to cover on that end today. Thanks for that input. And I am going to launch one more poll. Same kind of a thing, but a little different. Okay, so second question and last, this is it, I promise. What unapplied balance functions are you looking to optimize? Resolving backlog of unapplied credits like copays, prepays, managing deposit taken from for future purposes, or managing unapplied dollars on a daily basis. So it looks like about 20% of the people have voted so far. 40, 60, 80. What if we can hit 100? It looks like we're stalling at 85. So I think I'm going to go ahead and close this in 3, 2, 1. Close that poll and let's see where you stand. Share. Okay, so it looks like, again, everybody's having problems with similar things here. Unapplied credits and copays, prepays, deposits, and then a number of you also are managing unapplied dollars on a daily basis. So thanks for your input on that. And without any further delay, let's get started. Your presenters for today are going to be Tom Seco. He is the Business Development Manager at Attentive, and Joseph Schultz is the Vice President of Product Solutions, which means that Joe and his team are the people that actually built these great NextGen add-ons, and thus is going to be in a really great position to demonstrate them. Feel free to ask him any of your nitty-gritty technical details. That's why we have him on. So don't be intimidated. That's why we're all here. So Tom, go ahead and get started.
Okay, thank you very much, Chelsea, and thank you everyone for joining our webinar today. Here's an agenda of what we're going to be covering. We're going to be covering copays, deposits, and unapplieds, and with our Unapplied Deposit Manager software, and credit balances and refunds with line item credits and refunds on the RefundManager side. So we hope at the end of the webinar that you'll be able to understand and have a understand on how it increases efficiency and effectiveness while managing patient line item credits, refund checks, copay dollars, deposit money, and unapplied dollars. So what we have learned over the years as we've been working with our clients, they have mentioned a few challenges to us over these years with regards to unapplied dollars and line item credits. With regards to unapplied dollars, the most common challenges that we hear are the resolving a backlog of unapplied credits, managing unapplied dollars on a daily basis, meaning your copay dollars and things like that, and then managing deposit money for upcoming procedures. The percentages that you see here are the percentages of practices and health centers that have mentioned this particular challenge to us. So 81% of the practices and health centers have mentioned resolving a backlog of unapplied credits. On the line item credit side, the challenges, most common challenges that are mentioned to us are moving line item credits between charges and counters, issuing refunds to patients and insurances, and managing benefit control issues. Very much the similar challenges that you had mentioned in the poll today. And the percentages that you see there, again, are the percentages of practices and health centers that have mentioned these common challenges to us. So as we move forward with the webinar today, think about what your challenges are. Are they one of these common challenges that are up here on the screen, and or do you have some other challenge? And think about what causes those challenges. So it's a challenge because you don't have enough time, you don't have enough staff. Do you need to have an improved process? So do you need to apply automation to the process? So think about what causes those challenges to come about as well. So with that, I'm going to turn it over to Joe, and Joe's going to take you through a demonstration of both products so you can see how they work.
Okay, thank you. Thank you everyone for attending today. We're going to go through these quick, but reach out to us if you have more questions or if you want to do a demo one-on-one with your organization, and we can dive into them deeper. We're going to do a quick overview of both the tools. We're going to start with the Unapplied and Deposit Manager first, and then go with the Refund Manager second. The Unapplied and Deposit Manager is a rule builder where you tell it what to do, much like if you were instructing your staff on how to handle different scenarios with unapplied money sitting out there. And then it goes ahead and executes those rules overnight, and you come in the next day and you have batches to review. So this you'd only give to 1 or 2 people who'd manage the rules. It would do the work overnight, and in the morning you'd have batches. Refund Manager is more of an interactive tool where you get to search for line item credits in various scenarios to decide if you want to move them around to places where money's owed, or if you want to refund them out back to the patient or back to the insurance, depending on where the credit exists. So let's go ahead and dive into the Unapplied and Deposit Manager first. Again, this is the one that's the rule builder. So what we're seeing here is the rule building interface where we go ahead and set up what we want it to do. On the top of the screen, we have different sets of rules, okay? And each one of these is really what we're trying to accomplish. Now we could have one giant rule set, or like I've done here, we've broken it up into several rule sets. The other good news is these 4 rule sets are not what you're limited to. You can build out, using the instructions that are included, rule sets to do other things that we haven't imagined, or just variations on the things that we're showing you here today. So by clicking a rule set on the top part of the screen, down here on the bottom part of the screen, we see the instructions, the specific rules that are going to be carried out. I'm going to go ahead and cover our basic cleanup rule in some detail here, and then we'll move on to the Refund Manager after I show you how that works. The basic cleanup rule is one where we engage a client and they come to us and say, you know what, I have $100,000 or several $100,000 of unapplied sitting out there. Some's at the encounter level, some's at the account level, and we're just on a mission to get this money cleaned up. Finance is calling us daily, wondering when it's going to be taken care of so they can get the books straightened out. We're sending patients out and they're calling us back going, we gave you the money, why do I still have a balance? So we'd set up a rule like this one here. And again, you're not limited to this, but I'm covering it to give you an idea of the types of things that you can set up here in the Unapplied and Deposit Manager. The rules themselves are just built left to right, so they just read simply like sentences. So we have our simplest case first, encounter unapplied equals patient amount, apply it up to the patient amount. Sounds very straightforward. You can do that today in NextGen. But what about if the encounter unapplied amount is greater than the patient amount? Well, then we have a couple choices we can make. We can apply it up to the patient amount and leave some of that money in Encounter Unapplied, or you could apply it up to the unapplied amount and come up with a line item credit that then you might refund out using RefundManager or some other refund process that you have set up. And of course, if we're doing equals and greater than, let's set up a case here for if it's less than the patient amount. Now you can do one of these, all three of these, all depends on what you're looking to accomplish. You get to build out the number of rules you need to accomplish your scenario. Now in this case with the greater than, we're only applying it up to the patient amount. So that could end up leaving money in Encounter Unapplied. So I have another rule here that says Encounter Unapplied remaining amount. Let's move it up to the account, and then you have the opportunity either now or in the future to use it on other encounters where money's owed. So these 4 steps here really tell it what to do and what to look for on the Encounter Unapplied. Now we can refine this using what we call scopes, and the scopes really direct the processing. For example, this one here, skip encounter with no charges. Well, because we're taking the remaining amount and moving it up to the account, we don't want to even look at that encounter until the charges have been input in this scenario. All right, so we don't want to steal it right away. We want to give someone time to input the charges and then handle the encounter then. Additionally, we've added another scope here that says, not only are we going to wait for the charges, but let's also wait till the insurances get paid before we start moving around the Encounter Unapplied money. Now, in this case, you'll have a pretty good accuracy of what the patient amount will be, because if the insurances have paid, whatever's left in the patient amount bucket will be what you can apply against, and that way you can maximize it. Now, in some cases, you might want to use these rules. You might not want to use these rules. It's really up to you. So you have money that's going to be moved up to the account through the rules, and you may have money that's moved up to account unapplied or just posted straight to account unapplied. So we have a rule down here that says account unapplied remaining amount, apply it to the oldest debit, the oldest encounter charge, and then walk it forward till we either run out of places to put it or run out of unapplied money. So this will take care, again, in this case where we're trying to just get the unapplied money out of unapplied and onto line items, this will take care of those cases where it's account unapplied money and we're trying to use it on other encounters within the account. And then there's the outlier case where there's nowhere to use that account unapplied money. And maybe it's just sitting out there in limbo. So we have a rule here that says account unapplied remaining amount, wait age, then create a new encounter and push it down to the encounter, and we'll refund it back to the patient using RefundManager, which I'll show you in a bit. So here we say we're going to let it stagnate. We're going to let it sit and age for 45 days. So there's no new activity on the account, no new transactions, appointments, encounters, and so on. So if it just sits out there and languishes for 45 days, then this rule is going to say, okay, it's sat too long. And now we're going to create a new encounter with a dummy service item that we specifically set up for this scenario. We called it, in this case, AU refund for account unapplied refund. You can call it whatever you want. This is just a service item you set up in file maintenance. And the money will get moved down. This is a $0 service item, so it'll end up being a line item credit, and then you can refund it back to the patient and get it out of your system. So all some great options that are available here for this rule. Sometimes clients come to us and they just need something simple. That's one line in here, but sometimes it can be more than the, let's see, 11 lines that we have in here. So now, once you've built this out, you can go ahead and save it. And normally it would be executed nightly by a job kicked off in the BBP. But while you're on your test system, we have the ability to run these rules for several minutes just to make sure you're going to get the results you want. So we've set up some batch names for it. So these are the batches that'll be created that the transactions will go into. Normally we just hit save and let the BBP do it. But in this case, because we're testing and we're on a demo here, I'm going to go ahead and run it. And it gives me a list of the transactions that were put into the NextGen batch. We'll go look at that batch in just a second. And then we see down here, here's one where the money aged out, so it created that encounter with the AU refund. So the key takeaways here is that this is really not doing any magic, it's just doing work on your behalf. It's creating the transactions you'd normally have to key in and go find and clean up, and it's doing that work based on the rules you've given it. Much like I said at the beginning, where you have your staff doing it now and you've given them instructions on what to do in various scenarios, that's really what this is going to do for you each time. And so it populated these two batches. I can review them, I can prune them, I can delete them if I don't like them all together and go back and change the rules, or if everything's good, I can go ahead and post it. In this case, I'm going to go ahead and post that transaction where it moved it to the line item for the refund. All right, so the Unapplied Deposit Manager, it's a rule building interface. You tell it one or more things you want it to do, and it'll go ahead and execute those for you nightly, every night. It does everything from managing copays, managing money coming in via third parties, managing deposits where you can set up a cross-reference of money taken in with certain transaction codes, over to the service items where that money can be used and only used for those service items. So if you are taking deposit money, it's a great feature to have because you take it in, you give it the right transaction code, what type of deposit it is, you give it a name, and then over here you repeat that name one or more times, giving it either individual SIMs or modalities or a combination of both like I have here. So let's go ahead and switch gears now and talk about the Refund Manager. Refund Manager is an interactive tool. The primary reason for that is the ultimate disposition is sending money out of the practice as a refund. So because of that, we want people to have eyes on and pick a checkbox for each amount they're going to send out. And we streamline and automate the whole refund process so that you can quickly find those credits that are sitting out there on the line items on the charges and decide if you can move them around and keep the money in-house for the patient money, or if they're good candidates for refunds. I'm going to cover 3 modules real quick here of the Refund Manager. The Credit Scout is the NextGen facing component where you search for your line item credits sitting out there in NextGen and you give it criteria for what you're looking for, and it'll pull them up, and then via checkboxes you pick what you want to do. The second module we're going to cover is the Batch Detective. The Batch Detective will find batches in NextGen which contain one or more refund transactions that need to be exported out to your accounting system. We support about 18 different accounting systems and bank files. We're always growing that number as we run into clients that are using systems we are encountering for the first time. In the demo environment today, we're using QuickBooks, but keep in mind there's 17 others we support out of the box, and then we're always looking at growing that list. So the Batch Detective, not only will it find those batches, but it'll either talk directly to the accounting system or create an export file for the accounting system to read in so that accounting doesn't have to do data entry. And the last step here is the import, where we're going to go either read a file from the accounting system or talk directly to the accounting system and get that check number, check date, check amount of the refund check that went out from the accounting system and pull that into NextGen for you. So the Credit Scout, again, is the screen where I'm searching for credit balances in NextGen. What I've told it here is look for what we call distributions, the opportunity to move patient money from a credit to somewhere else on the account where there's a debit. And in our workflow, this is what we recommend starting with because you can go ahead and keep the money in-house as much as possible. The distributions are patient money only, so we're only seeing dollar amounts in the patient credit, not in the payer credit. If I want to look at one of these examples, I can expand it out. I can see Shirley's the guarantor with a $50 credit. Here's the account. Here's the owner of the money. If it was a refund, it could be insurance too, but it's just in this case, the guarantor owns the money because we're only moving patient money. Here's the encounter with the credit, and here's the charge. If we want to see more information, we can click on the encounter and get the transaction screen like we'd see in the chart. And here we see we have 2 charges and $145 payment. Those kind of look like they'll add up. let's go ahead and look at the charge ledger. And what we see here is 95 with a $50 credit. So all the money was applied to the first charge. Maybe the second charge hadn't come over or been entered yet, and the person taking the payment just posted it all to the first one to keep it processed. So if we decide, yes, this is a good candidate for a distribution, we can go ahead and click the D checkbox. And when we tell it, the system will go ahead and do that distribution. Oscar here has a $295 credit. So we have some tools here where we can look at account summaries, financial summaries, the distribution preview, what it's going to do. In this case, on the left here is where the money's coming from. On the right is where it's going to. If we look at the top line, it's coming from encounter 1213, taking $236 of the credit and moving it to 1214. So it'll go ahead and move that money for us. So when we're done and we've gone through our results, or at least as far as we're going to get today, we basically say process those credits. It's going to give us a summary of what it's going to do. And instead of you having to create those transactions, it just created them in NextGen on your behalf. So kind of like the Unapplied Deposit Manager was doing, it was doing them overnight. This one is going to be more interactive. Now, in addition to our distribution searches, we have credit searches to find credits which are good candidates for refunds as opposed to distributions. So now I did a refund search and I come up with several candidates here. We have Jennifer, who has several encounters with credits on them. This, because it's several encounters, might be a good place to use the account summary. I can see in this case we have charges, payments, minimum adjustments, so it most likely is a refund. Again, the other tools are available in here if you want to research it further, but because I have a couple more minutes to finish up, I'm going to go ahead and pick Jennifer as a refund, and along with hers, I'm going to pick several others just to show you how quick this is. So we have various alerts that can be configured. I've picked a couple that had refunds going back to the insurances. So in this case down here, the money belongs to the insurance with the policy number. Similar to the distributions, we say go ahead, process these. It's going to do all those transactions for us. And now they're in our batch in NextGen. So we can come over here. We still give you control over when the batches get posted. This is our refund batch that was assigned to RefundManager. I'm going to go ahead and total it out, and then we'll go ahead and post it. Again, this is a great check and balance because we're putting the batches, the transactions in the batches just like you would if you were doing it manually, except we're doing it at computer speed. So down here at the bottom, we have our distributions where we move the money around, so the net's zero. Up here, we have our patient refunds, and then up on top, we have our insurance refunds. So now let's go ahead and show you real quick how fast this goes out to the accounting system. Again, normally many practices would go ahead and print a report and accounting would have to key in that report. But what we're going to do is either generate a file the accounting system understands or talk directly to the accounting system, which is what we're doing here with QuickBooks. So it's opening up the connection to QuickBooks and it's going to go ahead and push those names and amounts over into QuickBooks. So accounting loves it because they just go in, review their batches of checks that are sitting out there waiting to print. They are out of the data entry business. They just validate it, get the check stock ready, and go ahead and print those checks. Now that the checks are printed, they have check numbers assigned to them, so we can close the loop by going back to RefundManager. And again, these steps can be done in the same afternoon or on different days. We can find those exports that we've done to the accounting system, and we can say, you know what, go get me those check numbers. Now it brought those check numbers back. So if we go and look at one of these encounters, we can see the process and what it looked like in NextGen for us. So I'm going to pick on Jennifer again, who had a refund. And we'll see, here's the transaction. And then because we completed the process, we have the check number, check date, check amount back in NextGen without having to key all that in. So it saves you money saves you time and money getting that back into NextGen. And then also the system created some encounter notes. So you know if RefundManager created that refund. And also when it was exported, it pulled the address that was in play for that individual or that insurance, because now in NextGen we can have several different addresses available. So that's the quick walkthrough of the Unapplied and Deposit Manager and the Refund Manager. I'm going to turn it back over to Tom to finish up a couple more slides, and then we'll take your questions.
Okay, thank you very much, Joe. And thank you for going through that with us. Let's see here. So with regards to both products, so each product individually, the Unapplied and Deposit Manager software works very effectively by itself. Refund Manager, processing the line item credits and the refunds, works very effectively by itself. Both of them combined together, working in tandem as Joe showed you, you now would have a comprehensive credit processing solution, both on the unapplied side in managing your unapplied credits at the account level, at the encounter level, and if your practice or health center takes deposits, being able to manage that as well. And with the Refund Manager, being able to bring some line item credits or created line item credits on the unapplied side over to the Refund Manager side and being able to issue refunds. So with that, with regards to next steps, if you have an interest in learning more about the products in an individual situation and how each product would work within your organization, you give us a call or send me an email, and we can talk about it individually and how it would work within your practice. We could also go into a more in-depth demonstration if you would like. And then if you have some questions, feel free to send me an email or give me a phone call. You see my information up here as well. So with that, we'll turn it over to answer any questions that you have at this time.
Okay, perfect. So thank you again, everyone, for joining us. If you have questions, please type them in the questions area of the webinar control panel. We only have a couple of them, and we're going to go through them in the order that we've received them. So if you're sitting on a question, don't hesitate. We have plenty of time. We'd be happy to get to it. So without further further ado, whichever, let's get started with the questions. Joe, it looks like this is one for you. Can Unapplied Deposit Manager help us with unapplied money coming in from our third-party portal?
Absolutely, it can. Unapplied and Deposit Manager is great for that type of solution. Some of you are taking payments that come in from an external system, and those payments come in automatically, and maybe your charges flow in automatically either from your EHR or through another EHR. And then you never get that pop-up in NextGen that says, hey, do you want to apply this unapplied against this charge? So they both just kind of sit out there, the charge waiting for its money and the encounter unapplied sitting there with money to give. So the system is great for looking for those transaction codes coming on from the third-party system, and then it'll take care of applying those each night on your behalf.
Perfect, thanks. Another question. What's the install process like and how much training is required?
The install process is pretty straightforward for both tools. We'll start with a kickoff call. We'll get the stakeholders from your IT, the business, the practice, and make sure we're heading all in the right direction. We'll send you training materials, which include videos and a user guide. And while the business side is looking at those, we'll work with the technical side to get everything installed and test. Then we'll come back together and we'll do some online sessions. We'll get you going and wired up, and then we'll set you loose and test for several days or a week. And once you're comfortable with that, we'll go ahead and do the production install. Itentive will handhold you all the way through the process, so we don't just throw the software over the wall and say good luck. We want to make sure by the time you're in production that you're getting batches of meaningful results for either of these products.
Great, thanks, Joe. Next question. What happens when NextGen pushes out one of their wonderful upgrades?
We've been doing this since 2005 with RefundManager, so we've gotten very good at keeping it up to date with NextGen, and we've been doing that for 15, 16 years with RefundManager and about 4 years with Unapplied and Deposit Manager. So we'll continue to do that. Those updates will be provided for you as part of your ongoing maintenance with the tools, and we'll even work with you if you want to install these systems into your test environment if you're testing a big upgrade of NextGen.
Okay, looks like we got another question here. What do we need to get QuickBooks? We have Refund Manager, but missing QuickBooks.
All right, the first thing to do would be to check with your IT and make sure they don't have a copy floating around, but QuickBooks can just be purchased retail. You can buy a 1 or 3 user license of QuickBooks to get started. I think the 1 user license is under $200 and the 3 user license is $450, $500, but you can get that from any retailer. Best Buy, Costco, Computer Discount Warehouse, any of those organizations can sell you QuickBooks. So it's readily available off the shelf out there, even on Amazon.
Okay, and it looks like this might be our last question, but we will hang around just in case anybody is in the middle of typing one. We currently run in a Citrix environment. Can we still use Refund Manager?
Absolutely. RefundManager runs in any environment that NextGen PM will run in. It's launched out of NextGen PM, as we saw here. And we use the same Microsoft stack to build these tools that NextGen is using to build their tools. Also, for the earlier question about QuickBooks and Refund Manager, once you get QuickBooks, give us a call and we'll help you get it wired in with Refund Manager.
Good note. Okay, well, it looks like that's about it for today. Again, if you think of any questions after we're done, you can always feel free to reach out to Tom or Joe. Their information is up on the screen to reach them directly. You can always reply back to the emails that I'll be sending, which have links to the recordings and the webinars and the webinar invites. All of those emails come from me. So I'm sure that if you search in your Outlook for iTentive, I might be one of the first names that pop up. Feel free to reach out to me. I'll make sure that your questions get handled by the right people, by the experts. So don't hesitate to ask. That's why we're here. We like to help.
Thank you, everyone.
Thank you very much, everyone. Have a great afternoon.
Have a great day.